In global health, there are multiple infectious disease challenges. If you look at infectious diseases in general, which are about 25% of the deaths that occur in the world. So it's the second leading cause of death worldwide. It's the leading cause of death among young people from birth to about 40 years old. It's clearly a very important global health challenge. If you look at the list, there's two types of infections that I like to look at it in a certain perspective. There's established infections, and there's the emerging and re-emerging infections. If you look at the established infections, like respiratory diseases, diarrheal diseases, they result in millions of deaths per year. There's HIV/AIDS, which 30 years ago was an emerging infection because it was new, which now, 30 years later, it's an established disease. Again, kills 2.6 to 2.8 million people a year. Then you have vaccine-preventable diseases like measles and other diseases where if you're not vaccinated, it's still a very important cause of death. Tuberculosis, malaria, neglected tropical diseases that we see in the bottom billion, and the bottom billion refers to the most destitute in the sense of resources, the poorest billion people out of the 6+ billion people in the world are the ones that unfortunately suffer disproportionately from a variety of these diseases that are important global health diseases.